Hi there, it's Laura Dankoff from pathtohealthandhealing.com. Today I want to talk to you about is what to do if you think you have hypothyroidism but you feel nobody is listening. I've seen so many women in particular over the years that go into their health practitioner and they're frustrated. They just are convinced they have hypothyroidism, but yet all their tests come back normal. So what is a person to do? Well, let's talk about a couple of things. First, let's talk about what the symptoms of hypothyroidism can be. And then also let's talk about a little bit about the testing of hypothyroidism and why sometimes this condition gets missed. Or you could also have symptoms that present like hypothyroidism, but actually it's something else altogether that's going on. So some symptoms that you may experience with hypothyroidism are thinning of the eyebrows, particularly on the outside areas. Maybe your hair is coarse and dry and you're losing hair. You can have joint pain and fluid retention, fatigue, brain fog, changing your menstrual cycle where you're getting heavier periods. You can be constipated. You can have dry and itchy skin. You can feel cold all of the time and mood swings, problems with fertility, muscle aches. So there's numerous symptoms that you can have, and some people even notice an enlargement of their thyroid gland, which is right in this area. It's a butterfly gland in your neck. So you go in and you have a TSH done and a free T4. Those are the common tests to have done. But what can be missing there is one, checking your thyroid antibodies, and two, checking your active T3 level, which is known as your free T3. You can have a completely normal TSH, which is commonly done, and a normal free T4, and totally miss that you're not converting that T4 well to T3. And that is often where sometimes underlying thyroid conditions get missed. And I did forget to mention too, you could have a lower body temperature. That's another sign that you could have a thyroid issue, particularly having a body temperature below 97 degrees Fahrenheit. So these tests often are not done or missed. So it's important to try to talk to your health practitioner and ask them if they would do those tests. But then on a standard lab test, there are what are standard lab ranges, and then there's optimal ranges. And oftentimes a person will not get the diagnosis of hypothyroidism because they're in the normal lab range. But we need to treat the whole person. We need to look at their symptoms. We need to consider what is an optimal range. And for example, a TSH on some labs will go up as high as 5.4, and you can be told you're normal. An optimal TSH, depending on the source that you may look at, can be anywhere from 2 to 3. And what's right for one person may not be right for another person. So it's important to ask your health practitioner about this. If you feel like you're not getting the answers you need, it's important to seek out the help of a functional medicine practitioner such as myself or others. But always be sure to consult with your primary care provider before doing anything, because it's important to maintain that relationship as well. But otherwise, certainly if you feel that you have a thyroid condition, these are some of the symptoms you want to be looking at and some of the testing that you want to have done as well. If you'd like to learn more information about how to balance your hormones and more, visit my website at www.pathtohealthandhealing.com, and I would be happy to work with you.